Okie dokie, I think we can jump straight in. So, first of all, I'd love to say welcome to everyone who has joined our webinar. It's lovely to have you with us. For those of you who are joining us for the first time, my name is Dr. Simi. I'm the Chief Medical Officer of GlycanAge, and I have with me also Dr. Lucia Sironic, who will also be here to answer any questions that you might have. So, today we have a really, I think, bold question, which is looking at, can we really outsmart cancer and chronic disease? And spoiler alert, the answer ultimately is, I believe, yes. So at GlycanAge, we've been doing a huge amount of research looking at glycan profiles, which I'll be talking a little bit about today. And what we're looking to do is understand if really, we can detect disease 10 years in advance, and actually giving this information in the form of what we're calling glycan insights in our reports. So today, what I'll be doing is talking you actually through what it is we do at GlycanAge, how we do that. So actually, what does the glycan analysis that we do in our lab look like? And also, we'll be looking at how does this translate into predictive power that we can use in clinic with our patients, with the people that we're seeing, but also what this looks like on the report, so you actually understand how you can use it with your clients. So what I would ask is that if anyone does have any questions, please feel free to drop them in the chat. We'll be answering them as we go. And then at the end, I will take some time to go through those questions and answer them verbally as well. But great to have everyone. I think it's evening for anyone who's in the US on the East Coast and West Coast. We are currently in Europe, so for us it's midnight. But let's have a party and let's just jump straight in. Okay, so I think the first thing that we have to appreciate is what it is that we actually do at GlycanAge. Some of you may be very familiar with us and the work that we do, but ultimately we look at aging. And we know that aging is the biggest risk factor for chronic disease, but it can be classified broadly into two different types. So we have chronological aging, which is simply the amount of time that you spend on Earth. I call it the passport age. For most of us, it's something that we cannot change. And then you have the other side, which is your biological age. And this is far more interesting to us because it looks more at your functional capacity, your ability to physiologically function. And what's most interesting about this is that it's actually modifiable. And so what we know is that people do not all age the same. While we might all spend the same amount of time or chronologically age the same, actually, when we think about biological aging, this can be changed depending on lifestyle. And this has a huge impact on our risk and susceptibility to disease, things like cancer and other chronic diseases that I'm sure we're all aware of. So at GlycanAge, our key focus is around biological age and helping people understand how they're biologically aging so they can change and reduce their risk. And this all comes down to the importance of preventative medicine, because we know that if we are looking at longevity, that actually that prevention is very key to actually unlocking that. So at GlycanAge, the key thing that we look at are glycans. Now, glycans are what I consider to be a game-changing biomarker. And the reason I say this is because they are like the level of complexity in our biology that is probably one of the hardest things to understand. And I think a lot of people often ask the question, if we have this amazing biomarker, why haven't we been looking at it for years? Well, to be quite frank, it is very hard to look at these. And so we are one of the only companies that is able to do this. And actually, we look at 85% of samples from across the world. And so, we are experts in this space. But to explain what glycans are, they are these carbohydrate-based polymers, which exist pretty much on every cell surface in the body. And actually, they are attached to proteins, and they're what make proteins functional. So they're included in every sort of element of biology, but they also are used for this sort of cell-to-cell communication, which is key. And so it adds this layer of complexity, and they're very information rich. So within them, they have a huge amount of information that gives indication to genetics, epigenetics, and also lifestyle as well. And this is where they're incredibly useful. And so most of the proteins that we are aware of in the body are actually forms of glycoproteins. And actually, when you look at just a protein by itself, without any of the glycans, they can't do very much. And it's actually these glycans that give them functionality. So just to kind of explain that a bit better, what we do know is that these biomarkers are incredibly useful because, first of all, they're very stable. So what I mean by this is that because if you did someone's GlycanAge today and then you did it again in a couple months' time without any lifestyle changes, actually you would see the same number. And this is incredibly important because if you are working with people or even with yourself and you have a biological age that is very variable, it becomes very difficult to track exactly what is happening and what's having a positive effect. Whereas actually with GlycanAge, because it is highly accurate and there's limited variability, what we can say is any changes that you see in the GlycanAge are actually functional changes, and they're meaningful as well. The other, I think, key thing is the highly responsiveness of GlycanAge. So if you are doing GlycanAge and then you implement a lifestyle change or an interventional medical change, you can again see significant changes in the GlycanAge. And so again, you can really track changes and see how effective they are in individuals. The other and very important point, I think, is the biology. So with a lot of biological aging, one of the things it's hard to do is track exactly what biological process is being affected. Whereas with GlycanAge, we have clear links to see that actually when you change a GlycanAge, what you are changing is chronic inflammation. And we know that chronic inflammation is one of the hallmarks of aging. And so as chronic inflammation builds, so does our risk of chronic disease. So actually, if you can measure that chronic inflammation, you can also measure risk of developing certain chronic diseases. And this is a key thing that we're looking at. And then finally, it's this concept of being an early warning sign system. So what this means is that, and this is the part we're really going to focus on here, but we've actually seen that these glycans can change up to 10 years in advance, which of course is a massively powerful clinical tool, which can enable you to give information to individuals about their risk of disease before it becomes a problem. And therefore you actually have the ability to manipulate and change that so they can move away from that. And you can actually see this very graphically and clearly with the GlycanAge, which again, I think is incredibly powerful. So just as a point, I think we've seen GlycanAge change significantly with things like weight loss, but also with interventions like HRT as well, and various other interventions that people might be doing as well. So I think this is, again, an incredibly powerful tool to actually see effectiveness and also how different interventions are affecting chronic inflammation within individuals. So one thing that I always really, really labor is that we have a lot of people make this mistake. It's very common, even PhDs who speak and make this error. So we are not looking at glycation. So glycation is what we see in HbA1c. This is a process of damage that we see happen to red blood cells because of sugar that really shouldn't be there. Whereas what we're talking about is glycosylation. So this is a different kind of process. It is a post-translational modification. So if we take our minds back to biochemistry and biology, we know that when a cell has DNA, that DNA is translated and transcribed to make a protein. And this protein has to undergo these changes. And these changes are imperative to enable that protein to function. And one of those post-translational changes is called glycosylation. This is the addition of glycans to the protein to enable it to function. It's very controlled, it's very regulated, and it's very enzymatically controlled. And the reason this is so important is because actually that process, again, is a very information-rich process. And so it gives a huge indication as to what's happening from a genetic point of view and also a lifestyle point of view, because it's affected by all of those different processes. So just to really drive home the importance of glycans, because I think for many people who hear about GlycanAge, sometimes the term glycans is a new word. It's a new sort of terminology, but actually they are present in pretty much every part of biology. So your red blood cell is a protein, but actually the blood type or your blood group is defined by the glycans on the surface of your red blood cell. Similarly, we know that conception, so when a sperm meets an oocyte or an egg, actually that conception is controlled by glycans. So glycans on the sperm enable interaction with the oocyte and enable conception. And then when we look at cancer, actually we know that cancer cells use glycans to hide themselves from the human's immune system. And so we can really see that glycans are incredibly important in every element of biology. They're just incredibly hard to measure, and so they haven't had the spotlight that they deserve. But actually now what we're looking at is the immune system. And so this is where we put our focus on at GlycanAge, which is actually looking at IgG and understanding that the glycans, which are attached to our adaptive immune system, or IgG in this case, these glycans are used to help the immune system communicate. And so what we do at GlycanAge is we look specifically at the glycans attached to IgG. The reason we look at IgG in particular is because, first of all, it is one of the most abundant proteins in the human body. Secondly, we know that actually the glycans change in a very predictable pattern with aging, but also they are massively affected by lifestyle and all those very important things as well. And so these are the key reasons we look at IgG. But also what we know is actually these glycans, which are on the surface or in IgG, they actually become more pro-inflammatory as we age, but not just as we age, as we expose to chronic inflammation, as we expose to certain types of diseases, we know that these glycans will change in very specific patterns. And what is even more interesting and what we're seeing now is that actually these glycans don't just change with aging or chronic inflammation, they actually change in very specific patterns with certain diseases. And I think this is a really interesting element and where we really begin to see what we're calling glycan insights come to life. Sorry, just bear with me 1 minute. Okay. Okay, so I think to really understand what it is we're doing at GlycanAge and sort of this very exciting element of, predicting diseases 10 years in advance, it's really key to actually understand what it is we're doing in our lab and how we're working with the science that we have. So I'm just going to give a very brief overview of the glycan analysis that we do, and then speak about how this translates into the predictive power that we are beginning to see with the work we're doing. So for anybody who has any background in biochemistry, this will be something quite familiar. But for everybody else, when we do glycan analysis, the process or the technique we use is called capillary gel electrophoresis, or CGE. And this is ultimately a process or technique for separation. And what happens is we put the sample in a kind of gel medium, and this sample is then separated out into its sort of biomolecular elements based on both the weight of the molecule and also the charge of the molecule. And what this does is create a very beautiful chart that looks kind of like this. And what you see here are a number of different peaks. So in total, there are 27 peaks here. And each of these peaks represent a glycan or a group of glycans. And so in total, as I said, we look at 27 different peaks, and 30 different glycan groups in total is what we can see when we do the separation. Now, what we know is that everyone has a unique glycan profile. I mean, as I mentioned, if you think about DNA, DNA has 4 subunits, right? So you have your adenine, your guanine, your cysteine, and your thymine. These are the building blocks of DNA. Glycans are far more complicated. There are far more subunits, and there are lots of different ways they can be put together. But what we do know is that in each individual, there will be a very unique glycan profile. However, with certain diseases, what we are seeing is this kind of emergence of what I like to call like a glycan fingerprint. So actually, if you look at a patient, like you see here, so this is an individual who had colon cancer, for example, and this is the glycan profile. And actually what we see is if you look at a number of individuals who have colon cancer, you will see these similar patterns start to emerge. And that's kind of what we're seeing with these glycan fingerprints. And actually, if you compare that glycan fingerprint with another individual who maybe doesn't have colon cancer, but actually there is similarities in the profile, we're seeing that this indicates an increased risk of developing this disease in the future. Now, of course, we didn't just look at one disease. Actually, at the beginning of 2023, we did a rather large systematic review where we looked at 300 different peer-reviewed papers. We looked at 72 different chronic diseases. And what we were finding was this similar pattern across multiple diseases. And so this kind of glycan profile similarities across various diseases, and actually seeing that develop up to 10 years in advance with various diseases. And so hopefully you can kind of grasp how powerful that is, that actually what we're seeing is that certain diseases have these very characteristic glycan profiles, and actually these glycan profiles start to develop years before disease. And so actually if you compare a patient's profile to what you see in a disease patient, you can actually see them moving more and more towards this disease profile and pick that up years in advance. And so I think for myself as a physician, I think one key question I always have is, okay, so this is really cool information, but how can I actually use this in practice? And what does this really, really mean for me? And this is where we've really tried to bring these insights to the people that we work with. So just as an example, and I think this is like, for me, I remember seeing this slide a few years back, a year back or so, and being incredibly just fascinated by the fact that this is science that exists, and actually these are tools that we can use in practice. But actually it feels like this is science. It's almost like a hidden gem, if you ask me. So in this graph, in this figure, what you can see is 8 different boxes. So each gray box represents a glycan. So, you know, we spoke about each of these peaks. So each gray box represents one of these glycans. The red marker that you see is when someone has clinically been diagnosed with type 2 diabetes. The marker that you see before this, so the one just here, hopefully you can see my mouse, is 4 to 2 years before disease. The one before that is 7 to 5 years before disease. And the one before that is 10 to 8 years before disease. And what is really interesting is that you can actually see that these glycans, they really start changing, as I mentioned, 10 years in advance of disease. So even before someone is clinically diagnosed with diabetes, we can see these glycans are changing in this very characteristic pattern. And actually, if you map that with someone else's glycan profile, you can see this movement towards a disease profile. And actually, if you have this information and you can share it, you can use this to help guide patient treatment plans and give them information about the direction that they can move in order to move away from their increased risk of this disease. So, you know, this is something that we see across the board in many diseases. So each disease has a different prediction profile, I would say. So, for example, we looked at hypertension, and we know that the glycans that are associated with increased risk of hypertension change about 6 years in advance. Similarly, we see this with cardiovascular disease, insulin resistance, and also type 2 diabetes, and all the various diseases that we've discussed. And so I think what's really interesting here for me is the AUC represents the specificity, or how predictive the test is. And actually, when you combine glycans with existing clinical markers, what you can see is a significant improvement in predictability. And this really helps to demonstrate just how powerful glycans can be, especially when it comes to helping patients understand where their disease risks are. And, you know, I think one thing that probably we all know and sort of agree is that traditional medicine focuses very heavily on disease care. We know that there is a big focus on sort of disease happening and then treating disease. But actually, a lot of preventative medicine is about picking up a problem before it becomes a problem. And in order to do this effectively, you need to be able to see disease before it actually happens. And that is where I think, again, the power of GlycanAge comes in, where you can actually see disease approaching before it becomes a problem, and you still have that ability to sort of move people away from that risk of developing the disease. So how are we translating this into our report? So we know that we have these amazing molecules called glycans, which give us a huge amount of information about what's happening in the body. We know that at GlycanAge, we look at this through a separation technique where we can see all these different elements that give information about chronic inflammation in the body. We know that this can be translated into predictive power and help us see if someone is moving towards disease. But how are we actually presenting this to the people that we're working with who are doing this in practice? And I'm just going to take you through what our report looks like now, and also the new changes that we've made as well. So if anyone here is familiar with GlycanAge and is using GlycanAge in practice already, you'll know that in the report, we currently provide you with 5 different indexes. So that is Glycan Shield, Glycan Youth, Glycan Median, Glycan Mature, and also Glycan Lifestyle. Now, as you saw previously, these are various different groups of indexes. And what is very useful about these indexes is that they kind of give high-level information, or what I call like the broad strokes. And so they represent groups of peaks. So just to show you that in a illustration, so as you remember this sort of very beautiful graph of lots of different peaks that represent different glycans, with the indexes, we are looking at a group of peaks that have glycans that have similar structural properties. And so as you can see here, glycan shield is one of the indexes we have. And all the glycans that are included in this are ones that have a similar structural property, this kind of square diamond thing on top. And so these are all grouped together as one index, and in this case, it's glycan shield. Similarly, we have glycan mature. So again, you have a group of peaks, and they all have a similar property, which is this kind of green square. And this is like a group of different peaks, which represents the glycan mature index. Now, the reason the indexes are useful and the reason we are keeping them in the report is because they are very powerful in helping to guide tailored treatment programs. So the way I like to describe it is if you were to do someone's GlycanAge and you can see these 5 different areas of health that you can potentially work on with a patient, you can use the indexes to guide specific areas that a patient might need to work on within their treatment program. So here's kind of a simple illustration of this, but we know that glycan shield, for example, is highly associated with diet and nutrition. And so if you had a patient who had a poor glycan shield, of course, the advice there would be to have a element of their program which focuses specifically on optimizing their nutrition and tracking that glycan shield to see how it improves as you improve the nutrition through whether that's IV or various changes in diet as well. Another example would be glycan mature, as you can see there. So we know this is really highly representative of hormone balance, and actually where patients have poor hormone balance, typically they will have a very poor glycan mature score. And again, we have a lot of partners who will use the glycan mature to titrate and actually help dose patients on their HRT. And so it's really about giving quite clear areas that you can focus on within a treatment program and then build a program around this. And so a lot of people we work with will use GlycanAge as a base to see where the patient or individual needs to work on, and then create a program around this and then track the indexes to understand actually how the program is improving across time. So as well as the indexes, which we have, so we have these 5 indexes, what we have added is clinical actionability. So we had a lot of feedback, and we try and speak as much as possible to the people we work with. And some of the feedback we got was, we need more clinical actionability. We need to know, what does this actually mean and how do we use this? And this is something that we've added to the report. So as you can see, you still have the index information here on the left, and you can see hopefully quite easily whether someone is having a poorer score or a better score by the red and green. And then you have some suggestions on what you can do to actually dive deeper into this. So this comes around what kind of clinical questions you might want to ask, also what additional metrics you might want to look at as well to dive deeper, and also what kind of lifestyle interventions could support with this patient, both lifestyle and medical interventions as well. And then, of course, we have my favorite part, or the bit that I'm most excited about, and the newest part of our report, and this is the glycan insights. So everything I was speaking about in terms of predictability and being able to actually see disease before it becomes a problem is what we've packaged into glycan insights. Now, it's important to recognize that this is still in the beta version. And so we are still working to gather more evidence on this, do more clinical validation, but we are at a point where we feel comfortable enough to share this information with our partners. And actually, as I mentioned, this is based on a significant amount of research that we've done, and we want to be able to give these insights and see just how well we're able to pick up this risk of disease. And so at the moment, we are giving the information on the diseases you see here on your right. I believe there are 11 or so in total. And these are the diseases that had, first of all, the most change in glycans. So what this means is that when we looked at someone who was healthy versus someone who had hypertension or rheumatoid arthritis or any of these diseases, we saw the most significant changes in their glycan profiles. but also these were also the diseases where we saw the most clinical validation and saw the most evidence on them. And so these are the diseases we've released so far. The aim over the next few years or so is to release more diseases in tranches. So as we gain more clinical evidence and see more evidence in this, we will start releasing the other diseases that we have information on as well. And so just to give you a kind of view of what this looks like in practice or in the report. So as you can see on the right-hand side, you see kind of this bar graph, very similar to the peaks that we were showing. And so the light green that you see represents what we expect to see in someone who has disease. So in someone who had the disease, so in this case, colorectal cancer, we would expect them to demonstrate a pattern that you can see in the light green. The dark green, on the other hand, is the actual patient. And where there is here, for example, no overlap, this suggests that the patient is low risk of developing the disease in the future. On the other hand, where you have the patient's results, the dark green overlapping significantly with the light green, this could suggest that there might be an increased risk of developing this disease in the future. Now, it's very important that we are very careful with our language here. This is not to say the person has the disease. It's more about trying to understand the level of risk a person has for developing the disease in the future. And as mentioned, there is still further research we're doing this to clinically validate this. And actually, this is more about giving insight into where a patient could really focus to reduce or change their risk. And so in the actual report itself, we give quite a broad range of information. So at the top there, you see the disease that we're speaking about. We give a bit of insight into what that disease is. And then, of course, we give the actual glycan insight. So how does your patient compare to what we might see in someone who did have rheumatoid arthritis? And then, of course, like with every clinical test, it is about triangulation. It's about bringing the information together and using it to make clinical decisions. So in this case, of course, with rheumatoid arthritis, some of the key things you're going to really want to look at is family history, sex, because we know that there is differences in risk profile for different sexes. And then on the right-hand side, we give some information about, so is there overlap and what does this mean? And finally, give some information about symptoms that we might want to check for and further testing that might help to identify if this is a problem within the patient. And I would just like to put like a caveat around the symptom checking. So one of the challenges with preventative medicine is that you are looking for a problem before it becomes a problem. I've said this a number of times across the webinar, but ultimately this is what we're doing, right? We're looking for a disease before it's actually a disease. And what this typically means is that you're not going to have patients who are necessarily having symptoms. Now, we have seen situations where patients have maybe borderline broad seeking symptoms that aren't very clear, and they've done a report and it's given some sort of indication as to what might be driving these symptoms. But largely speaking, it's very plausible that you will have patients who maybe don't have symptoms because the disease has not yet clinically manifested. And so, yes, we offered the symptoms that you might want to check for in certain diseases, but actually it's important to remember that because we are looking at preventative medicine before disease becomes a problem, that people might not present with your typical clinical symptoms that you would look for when you're doing examination, history, etc. So again, another very key question I think we always have to ask when we're looking at using tests in practice is how actionable is this? So we spoke a bit about how indexes can be actionable and used to build treatment plans, but actually what can the Glycan Insights do that, how can they give you information that you can actually action for clients, patients, or even yourselves? So the ultimate answer to this is yes. And we are still doing more research around this, as always, because we are a research-focused company. But ultimately, what we are seeing is that glycans do respond to interventions. And this is where the real power comes from. Having a test that tells you are older than expected, but does not enable you to change that or modify that is pretty useless, if you ask me. We need to be able to see that the test is effective in actually responding to interventions that reduce risk. And we have seen this with our test. So just as an example, we looked at cardiovascular disease or cardiovascular events. And as I'm sure we're all aware that aerobic exercise can significantly improve risk of cardiovascular events. And so we looked at a population of about 400 people who were middle-aged, so between 41 and 59. They had raised BMI. The intervention that we implemented was 12 weeks of 60 minutes moderate intensity exercise twice a week. And what we saw is that actually these glycans, so the glycans that are associated with increased cardiovascular event risk, actually started to improve within that 12-week period. And so this is an intervention that we know works. So we already know from evidence, from science, from general knowledge, really, that cardiovascular exercise does work. We implemented it to see if it would actually have the effect on the glycans. And we did see that the glycans do respond to it and they do change. And what this means is that actually, if you do implement interventions within these disease risks, you will see the glycans change as that person responds to the interventions, especially if they are working for them, of course. And I think this is really where, again, a really powerful tool, because actually, as we know, medicine is not one size fits all. Everyone is different, especially when it comes to things like diet, exercise needs, even interventions, even medications that we use for people. People are individual. And so you almost need an N of one study. And so you need a marker that is individual and specific to them. And this is what GlycanAge provides. And this is where the Glycan Insights can be incredibly powerful and very useful. And so coming to the end now, just to kind of summarize how we can really use this in practice. So number one, where we've seen this be really powerful is, first of all, validating patient concerns. We've had some really great feedback from individuals who have done this test and who we've given the Glycan Insights to, where they've had clinical concerns previously that they weren't very sure about. And actually the Glycan Insights have pointed them in a direction that has given validation. But also it's really helped them to guide the treatment plans of where they need to focus their energy. And then finally, of course, the ability to track the response to therapy is incredibly important, so you know what is working well for the patient or individual. I think, like always, we are continuing to advance our research. So as I mentioned previously, at GlycanAge, we are a heavily research-focused company. We are, as I said earlier, we are the lab that processes 85% of glycan samples across the world. And so we have a huge amount of knowledge and wealth, but we are still learning. Glycans are incredibly complicated, very useful, information rich, but because they are so complex, there's always more to learn about them, and we are still doing that. At the moment, the Glycan Insights we are providing is a beta product, and what this ultimately means is that it is undergoing continuous change and improvement based on feedback that we're getting. It's also not yet clinically validated, and so it's not a risk score. This is not about saying you have 10% increased risk of X, Y, Z, because we're not at that point yet where we fully understand the quantifiability of the information. But what we do know is actually as people move more towards a certain disease profile, there is increasing risk. We cannot quantify this just yet. And then, of course, we do know that that glycan profile can change up to 10 years in advance. And of course, that's incredibly useful. And then I think the key thing for us, and one of the reasons we're releasing this, is because we need the feedback. So we want to understand, actually, as we give you access to these reports, there's a short survey at the end of the report which asks the questions around, has this aligned with what you might have seen in your patient or with the clinical history of the individual as well. And so that feedback is going to be incredibly valuable to help us understand how, if this is giving it the information expected, and actually how we can further improve the product as well. So I'm going to end there and sort of open the floor to questions, but just some key information. So this is, again, maybe I'm a bit biased, but this I think is an incredibly useful tool that could be revolutionary for individuals, especially for people who have this increased risk and are completely unaware of it, which I'm sure many of us have seen. And so we will be releasing this report on the 15th of February of this year. And for anybody who is looking to trial the test on themselves, we have a discount code there. Feel free to use the QR code. And if anyone is an existing partner, so you already signed up with us, please use the QR code on the right to fill in a form and let us know if you would like to purchase any test kits at an increased discount to celebrate the launch of this amazing product, which I think will have huge impact in terms of the longevity and preventive medicine space.